Hi everyone, my name's Louise and welcome back to my channel. If you're new here, I run the Life with Scoliosis blog, where I blog about my life and experiences of living with scoliosis. In this video, I'm going to be talking about some common symptoms of scoliosis as part of my scoliosis education series of videos. Firstly, it's important to understand what scoliosis actually is. To put it simply, scoliosis is a sideways curvature of the spine. Scoliosis can develop in the upper spine, the lower spine, or even in some cases, there can be two curvatures in both the upper and lower spine. For more information on scoliosis and what it is, please check out my first video in my scoliosis education series, What is Scoliosis? What are the symptoms of scoliosis? The thing about scoliosis is, when it first starts to develop, especially in children, there often aren't any symptoms. It's often only when the scoliosis starts to progress to a level where intervention is needed that the scoliosis is noticed. This is why early detection is crucial for scoliosis, as the earlier that it is spotted, the better the outcome often is for treatment. In this video, I'll talk about some of the most common symptoms that are often associated with the development of scoliosis in teenagers. This type of scoliosis is called adolescent idiopathic scoliosis and was the type of scoliosis that I was diagnosed with. It most commonly develops between the ages of 10 and 15 and is more common in girls. The main symptom of scoliosis that is often noticed first is rib protrusion. This is because as the spine curves, it also rotates, which causes the ribs to protrude on one side of the back. This can also cause ribs to stick out on the front as well, and I remember when I was a teenager, that was one of the first things that I noticed. Scoliosis is most noticeable when bending forward. This is a common check for scoliosis and it's called the Adams bend forward test. The rotated ribs can also cause the chest to appear uneven, and girls may notice a difference in breast size or that bras don't fit quite right. Linked to this is usually one shoulder blade protruding more on one side. And when scoliosis is developing, you may notice that it's uncomfortable to sit on certain chairs and that your clothes don't hang quite right. Other things to look out for include an uneven waist, where the waist is curved on one side but straight on the other. Also, one shoulder appearing higher than the other. Depending on where the scoliosis curve is, hips may appear uneven or tilted, or the person may be permanently tilted to one side with their head off centre. In many cases, which is what happened in my case, there are often two curves where the spine forms an S shape. When this happens, the scoliosis can be difficult to spot and it may go unnoticed for some time. This is because the two curves often balance each other out and the person can appear quite straight. The best way for checking scoliosis is to have the person bend forward and watch their back for signs of unevenness and ribcage protrusion. In some cases, if the person is very slim, or in severe cases, you may be able to see the curve of the spine when the person bends forward. Other symptoms of scoliosis include chronic back pain, muscle stiffness, and neurological issues like numbness and pins and needles in the back, legs, and arms, although pain is more common in adults with scoliosis. In very severe cases, scoliosis of the upper spine can sometimes cause issues with breathing and the lungs, although this would only be the case in very severe cases that have been left untreated. And perhaps more importantly, having scoliosis can affect body image and self-esteem, especially in children and teenagers. This can also lead to anxiety, depression, and other mental health issues later in life. If you are interested in this topic, I do have a video where I talk about the impact of scoliosis on my own mental health. If you would like any support or advice about scoliosis, or to find out more about the symptoms of scoliosis, then I would recommend visiting the Scoliosis Association UK website and I'll put a link to the website in the description below. If you suspect either yourself or someone you know may have scoliosis, it's really important that you go to the doctors and get it confirmed and diagnosed with an X-ray. Most people with scoliosis, including myself, are able to live normal lives and do most things, including most exercises and sports. However, it is crucial that it is spotted and treated early, especially in growing teenagers, as scoliosis can progress very rapidly during this time, so don't delay in getting it checked out. Thanks for watching. I hope you found this video useful. If you did, please feel free to give it a like or consider sharing to help me raise awareness of scoliosis. Thanks for watching, and I'll see you next time.